is not uncommon to hear of someone who's got an allergy to penicillin.
But it turns out many people who think they're allergic might not be allergic at all. CBS News' Dr. Max Gomez is here to explain. Dr. Max?
That's right, Alice and Maurice. So, what's the harm, right? Even if you're not really allergic to penicillin, the worst that could happen is you avoid that antibiotic and get a different one. Well, those other antibiotics may cause more side effects, not work as well, and they're certainly more expensive.
Refers to the penicillin.
Claire Brandman is among the millions of Americans who think they have a penicillin allergy.
I started saying it since I was a little kid because my mom told me that when I was a baby I had had an allergic reaction.
At 26 years old, Claire is now getting an allergy test to find out for sure, and here's why.
10 to 15% of the U.S. population thinks that they're allergic to penicillin, but in actuality, less than 1% of these patients are truly allergic to penicillin.
You heard that right, less than 1%.
When we're children and we have this added to our medical record, then over time, as we get repeated infections, we don't ever address the issue again.
For Claire, the alternative antibiotic for a minor dental procedure was not only more expensive, it led to much bigger health problems.
It was a nightmare, and I actually ended up having my stomach kind of messed up for a few years since then, which I thought maybe if I wasn't allergic to penicillin, I could have avoided that.
A penicillin allergy prevents patients from taking any of the penicillins, including amoxicillin and augmentin.
And the first question it asks is, was the reaction unknown?
Allergists at Mass General Hospital in Boston have now developed an app to help doctors quickly identify patients who should get tested. It's now being used at 2 Harvard-affiliated hospitals.
It helps the doctor or the nurse ask more detailed questions that are usually sort of allergy specialist knowledge, but sort of at the palm of your hands.
After 2 skin tests, Claire finds out she's not allergic to penicillin, which could make a world of difference the next time she gets sick. So who should get tested? Well, it could be anyone who believes they have a penicillin allergy, especially if they don't recall why someone told them they were allergic. But you should be tested when you're healthy, not when you're sick and you already need an antibiotic. A little late at that point.
Understood. Thank you, Doc.
You bet.
Thanks, Dr.